I'd like to bring up our next speaker, Dr. Kathleen Mary Wesa from the Memorial Sloan-Kettering Cancer Center. She will be talking on integrative medicine and nutritional considerations. And actually, some of the questions that were brought up here on neuropathy and nutrition, I'm sure she's going to be covering this topic. So,
thank you. All right, last speaker, so here we go. All right, so I don't have any financial disclosures. All right. I want to start out with terminology because words are important and different words have different meaning. Okay, so is there a difference between alternative and complementary? Absolutely. Alternative things, or so-called alternative regimens, are promoted for use instead of mainstream treatment for cancer or other serious illnesses. They're typically biologically invasive. They're very costly. Healthcare insurance typically doesn't cover these, and they're potentially harmful. One of the main problems is that if someone will say, well, you know, I'm not going to try chemo, radiation, whatever, I'm going to try this quote-unquote alternative, and I will tell you that there are no viable alternatives for cancer treatment. You need to seek, you know, reputable medical care and the best quality that you can. Because we all know that the earlier things are diagnosed and you receive appropriate treatment, the better the outcome is. And so if you say, well, I'm not going to try this or that, I'm going to try some sort of herb or nutrition or something else, and then you wait a few months, the cancer grows and multiplies at a much more advanced stage and it's harder to treat. The complementary therapies, on the other hand, are used with mainstream care for serious illnesses. They're non-invasive, inexpensive, safe. They're evidence-based, they are rational, and they are for decreasing either the side effects from the cancer itself or from the cancer treatments. So they allow us to really help the patient to receive the dose and regimen that the oncologist or the radiation oncologist has recommended. They help the body to be as resilient as possible, and they reduce a lot of fear and distress, and it helps to empower patients in a time when things can seem again out of control. They're safe, non-invasive, and very easy to use, and they are pleasant, okay? So our major modalities, the touch therapies, that include some massage, reflexology, Reiki. I consider Reiki as like light touch massage. Mind-body therapies. This capitulates on the reciprocal relationship that we have between the mind and the body. When you calm the mind, in turn you calm the body. And when you calm the body, you also calm the mind. And so, these are things like yoga, tai chi, qigong, meditation, self-hypnosis, guided imagery, breath awareness, all of these things. Contemplative prayer, say the Catholics will do the rosary, these types of things. Very, very beneficial. And how I choose a type of mind-body therapy is really based on the patient. If someone is very hyper and active and they can't sit, doing some sort of seated practice is probably not in their best interest, but doing some sort of walking therapy, walking meditation, this type of thing, breath awareness while they're exercising, this is very good. People who are more frail, not as active, or have limited mobilities or neuropathy, that type of thing, then doing more of a seated practice, would be more the first line of choice for them. Music therapy, also used very, very commonly. Now, this is not just listening to music. Music therapy is actually therapy. But instead of using words like we normally think about psychotherapy, this is performed by professional musicians who do internship and special training in music therapy. So when we use the music, we bypass the higher cortical centers. And so this is very, very beneficial for patients, say, who are more frail or who may not have access to words. They might be intubated, they could be a whole host of things. But you can really get profound healing for not only the patient but for family members using music therapy. So very, very beneficial. Acupuncture, we use it a lot. It probably has the most rigorous science behind it and looking at mechanisms of action and things. And actually for neuropathy, we use acupuncture a lot. There's a lot of clinical trials looking at this. And again, it doesn't benefit absolutely everybody, but for many, many conditions, you can see considerable improvement, especially in something like hot flashes, xerostomia, some of the peripheral neuropathy, fatigue, these types of things. Very, very beneficial. And the needles, they're tiny. They're like 38, 40 gauge needles. Most blood drawing needles, the thinnest ones are 25 gauge. So the acupuncture needles are actually skinnier than a human hair, and they're going just a little bit, and you don't really feel it. I've had acupuncture myself hundreds of times from rehab, from different things. And it feels more like somebody's poking you with a finger. It's not, mosquito bites are much worse than acupuncture needles, really. So very, very beneficial. Fitness, both physical fitness and nutritional fitness is another component of the integrative therapies. These things are very, very important. And then also the botanical therapies as well. And that would be some of the mushrooms or some of the herbal extracts. Many of the symptoms that we have, that we experience, both people who have cancer, who are undergoing treatment, and just, people who don't have cancer are very, very amenable to the complementary therapies. Pain is one of the main indications for acupuncture. When I was in Minnesota, Blue Cross Blue Shield would pay up to 10 visits to an acupuncturist without prior authorization for pain management. It's recognized as being that effective. Now, it varies from state to state. New York is different, and New Jersey and Florida, of course, is different. Nausea, fatigue, depression, many of these things, anxiety, insomnia, constipation and ileus, definitely, beneficial for many of our therapies. The hot flashes, again, about 70% reduction in intensity and frequency of hot flashes using the acupuncture, the dry mouth, xerostomia, many of these things, physical deconditioning. Lymphedema, using acupuncture, again, very, very beneficial for that, and neuropathy as well. Okay, so looking at nutrition, the World Cancer Research Fund and the American Institute for Cancer Research, they came up with, a few years ago, there are 8 major recommendations and 2 minor recommendations. Number 1 is body fatness. You want to remain normal body weight throughout your whole lifetime. Being overweight is not good. Being underweight also is a risk factor for complications and is not desirable. For physical activity, you want to be physically fit. You want at least 30 minutes sustained fitness 6 days a week. And a couple years ago at the AICR meeting, we had a whole afternoon on exercise physiology. I said, okay, so my patient, they say 30 minutes 6 days a week. My patients are always asking me, can I do an hour 3 times a week, 90 minutes twice a week? And the exercise physiologist's eyes got really big, and they looked at me horrified and said, absolutely not. If you want to increase your fitness, you have to do daily. So that's it. So daily, you have to do. Now, when I was in Minnesota, they had Blue Cross Blue Shield said, groove your body 10 minutes 3 times a day. Well, they're looking into, the different prescriptions. If it's, 10 minutes 3 times a day, 30 minutes, of intense activity. Better is always more, what you can do. So if you're really exhausted, at least do 5-10 minutes of slow walking, something. For every day we're sedentary, we lose strength. It takes you 2 days to recover. So you lose strength very quickly. It takes a long time to regain. So even if you're sitting up at the edge of the bed, dangling your legs, going back and forth, walking slowly, that's okay. But on no day can you be total sedentary. That's just not good. Number 3, foods and drinks that promote weight gain. These are our sugary beverages. How many people drink coffee? Okay, a lot of people. Okay, when I was in Minnesota, it was black, coffee black. I moved to New York, coffee regular is cream and 2 sugars. So how many people have sugar in their coffee? A few. Okay, so would you put 1 in, 2, 3, okay, 5, 10? Okay, no? Okay, can of Coke has the equivalent of 12 packages of sugar. A can of ginger ale has the equivalent of 17 packets of sugar, and it doesn't even taste sweet to us. We think nothing about taking a can of Coke or a can of ginger ale and having our cookies and cake with it. All right, so the sugary beverages, these things, they're very high in glucose, and there's almost no nutritional value, so it's really not recommended. No fast foods either. These things are just, not, it's metabolically disaster. The fast foods, we really want to not have the fast foods. You want to have more plant foods. Foods, at least 2 to 4 fruit, 3 to 5 vegetables every day. So at least 5 plus normal size, fruits and vegetables. 1 serving size about the size of your fist or a baseball. And you don't want the starchy foods, the tubers, the potatoes, the starchy staples. Those really don't count as a vegetable. All right, they're starchy staples and they're something different. So if you are eating those, then you have to actually add additional fruits and vegetables in order to make up your 5 plus, okay? All right, next one, animal foods. All right, you want to limit the intake of red meat. Red meat is not healthy. And despite all the marketing, from the Pork Council is calling pork the other white meat, pork is considered red meat. our body. All right, you'd want less than 2 servings per week. Less is even better, and if you never have it, that makes me happiest, really. When you're cooking it and grilling, there was a question, before about grilling and barbecuing. There's 3 ways that grilling and barbecuing is bad for your meat, and that's fish, chicken, and red meat. All right. The high heat with the animal protein makes for the aromatic hydrocarbons. These things are bad. You get the charring, which is the hydrocyclic amines, and that's carcinogenic. And then you have the fat that drips down, and then you get the smoke, which are also more hydroaromatic carbons. And so there's 3 different ways that grilling and barbecuing is not a healthy way. You walk through Sears, you walk through Home Depot, you would never know that it's not a healthy way to cook your food, but it is not. You want to use lower heat, longer period of time. So your crock pots, your soups, boiling, poaching fish, these types of things. Alcoholic drinks, less than 1 per day for women, less than 2 per day for men. And the less you have is really better. There's other ways to be heart healthy otherwise than having an alcoholic drink a day. All right, because alcohol, it pickles your body. It's a risk factor for gastric cancer, many other cancers, and it alters your liver enzymes and just is not all that healthy. When you're looking at preserving food, you don't want to have a lot of foods that are heavy in salt content. So drawing it, the beef jerkies, this type of thing, not a healthy way of preserving things. And many of the moldy grains and things, they have the aflatoxins, and so that's a risk factor for liver cancer. But you don't really want to have that. And the processed foods too, like the salamis, the sausage, the luncheon meats, all of that, really very bad. It's high in nitrates, and those are risk factor for many other cancers. Their 8th recommendation was regarding dietary supplements, and really dietary supplements are not recommended for cancer prevention, and cancer survivors also take the recommendation for cancer prevention, and that's that dietary supplements are not recommended. We should meet our nutritional needs through diet alone. The best form of vitamins and minerals is from food and not from supplements. The only exception to that is vitamin D. The American Cancer Society tells us we should get our vitamin D from a supplement and not from sun, because the supplements do not increase our risk of skin cancer and melanomas, whereas unprotected sun exposure does. And for most of the country, if you live north of Atlanta, Georgia, you're not going to make any vitamin D between October and May. You could stand outside all day long in a bikini and not make any vitamin D. So best to take your supplement anyway. Okay, a few myths. Is it really sugar feeds cancer? Okay, if you look on the internet, they'll say yes, but no. We've heard multiple times today that it's not necessarily that simple. And you could fast and have only water, as we just heard, and your body will synthesize glucose. That doesn't mean that we should have a lot of the sugary foods and the simple carbohydrates that are broken down into glucose immediately. They're really not high in nutrition, and these drive high insulin states, and it's the high insulin states which drive the growth factors, okay, and obesity and inflammation. So you really don't want that. But so sugar, nothing is ever that simple, and it's that trite. Can the acid-alkaline diet change your blood pH? No. We have a buffer in the blood. You can eat, quote-unquote, alkaline foods. When you look at the alkaline diet, they say no white flour, no white sugar, no alcohol, and have more plants, less animals. Well, that's a healthy diet because that's a healthy diet, not because it's going to alter your blood pH. You can alter your urine pH a lot because of our buffer in our blood. If your blood pH changes even 1/100th of 1,000, immediately your kidney kicks in and starts either holding on to or getting rid of hydrogen ions. Why? To keep your blood pH at 7.4. If after 12 to 15 hours our kidneys can't handle it, our brain kicks in and changes how we breathe. Why? To keep your blood pH at 7.4. If you live out on Long Island, you can spend $3,000 for this water wand that will quote-unquote alkalinize your water, which will not do anything to change your blood pH. Will just make you sick because you change your pH of your stomach and then you don't digest your food. So it's just craziness. The paleo diet, this is just nonsense. It's a food fad. It doesn't help. Gerson therapy is a bogus cancer treatment. It involves a very nutritionally restrictive diet with a whole host of enzymes and adding a few other supplements, many of which are not helpful, such as amygdalin or Laetrile, which is metabolized to cyanide, which is very toxic. The Budwig diet is high amounts of cottage cheese and flaxseed oil, which again is not a treatment and not recommended. Will coffee enemas be helpful? Absolutely not. These can cause electrolyte disturbances. People have actually died. They've gone into cardiac arrest and died because their potassium and sodium and things have been altered from these coffee enemas. That's part of the Gerson regimen, so-called regimen. Can asparagus cure cancer? No. No, sorry. Is hemp oil a miracle? No. There's a lot of marketing for this and a lot of propaganda, and I've had I don't know how many consults, and I've been called to the ICU for family members who've been, desperate, wanting to, feed their sick family member this hemp seed oil, and it does nothing, to treat the cancer, and it can cause a lot of problems, and, it's one of these bogus treatments that's marketed on the internet, and it's just malicious. Okay. All right, how about preventing weight loss? You really want to increase the good fats, nuts, and oils in your diet. And I like coconut oil. This is one of the medium-chain triglycerides. It's very, very healthy. All the other palm oils are bad. They're atherogenic, and when we look at many of the animal studies, those are the positive controls for hardening of the arteries and heart disease. But actually, coconut oil is, even though it's about 95% saturated fat, it's a healthy oil. You increase your HDL, lower your LDL, and it's actually very beneficial. You want more of the complex carbohydrates, not the simple carbs. And I like for patients oftentimes to try and drink their calories instead of having more solid foods. Think about drinking your calories through smoothies and pureed soups, that type of thing. Use more of your yogurt-based smoothies, some whey protein, things like that. If you have just a piece of hard meat, it can be very hard for your body to digest that. Consider more plant forms of protein and your omega-3, some of the softer forms of fish, your salmon, walnuts, chia seeds. Flax is another form of omega-3, but that's a phytoestrogen, and I'm not real thrilled with people taking high amounts of phytoestrogens. We're just not sure how safe that is. Okay, so dietary supplements here, or substitution. Right? Because of all the marketing, really, there's a lot. People think you can do meal replacers and this, that, and the other thing, and it's just not so simple. In 2012, it was $30 billion. If we go back to 2009, it was $20 billion. 2010, it was $23 billion. 2011, it was $28 billion. And then in 2012, it was $30 billion. I don't have the data from last year, but I know it didn't go down. The question is, by how much did it increase? And when we were at $30 billion, that was about a little over 1/4 of what was spent on all pharmaceutical drugs, just on botanicals, okay, and other supplements. So there's a ton of money to be made on this, and there's a lot of marketing. Greed is a great motivator for a lot of people. All right, the internet is not always our friend. You have to be very careful, and there's a lot of infomercials, and that you are not going to get reliable medical information from an infomercial. All right, just keep your thinking cap on. You're not. All right, and things come and go in popularity. 3-4 years ago, all you heard about was echinacea. Now you don't hear boo about echinacea. It's all the antioxidants. It's your goji, the noni, the pomegranate, resveratrol, acai, selenium, CoQ10, vitamin A, C, E, right? All of these things. And these are antioxidants. Now think about this. When you eat a banana, it doesn't just go to your left eye. Our body metabolizes and it goes everywhere equally. Why we think the antioxidants are only going to go to healthy cells, not go to cancer cells, I don't know. But really, what happens is you take these supplements, and even many of the foods, if you're juicing, you're concentrating, you're overdosing, these things go to cancer cells just like they go to healthy cells. And many of our treatments work solely through an oxidative process. Your platinum-based chemotherapy regimens, oxaliplatin, this type of thing, plus your radiation works solely through an oxidative process. So you're getting your treatment, you're taking these antioxidants, you're canceling it out. All right? We're running a marathon here. You do not want to be shooting yourself in the foot and wondering why we're limping. All right? Now, the largest study that we have looking at antioxidants concurrent to therapy is 540 head and neck patients. They were given vitamin A alone, vitamin E alone, both vitamin A and vitamin E, or a double dummy. All right? The only group who did well were the ones who got the double dummies. The group who got the antioxidants and the ones who got vitamin A and E did the absolute worst. Yes, they had less side effects from their radiation treatment, but that's only one part of the story. You also want to make sure that I'm not altering the efficacy of the treatment. right? Side effects we can manage in other ways other than antioxidants, right? What was the most concerning was that there were far greater deaths and early deaths in the people who got both the vitamin A and the vitamin E, and especially in the smokers. They had, almost 3 times the death from this. So you want to be very careful when you're taking treatment and not do something else to try and, fix side effects that may be altering the efficacy of your treatment. All right, wheatgrass is very popular. The human body cannot absorb chlorophyll. We're not a cow. We have a different digestive system. We only have one stomach, not multiple. And, the human body cannot absorb chlorophyll. Many of the proponents of wheatgrass say, well, it increases your hemoglobin because of the chlorophyll, but we can't absorb it, so that's nonsense. It's not factually based. Vitamin D is probably important. There's a lot of research in that, and we think probably if you have normal levels of vitamin D throughout your lifetime, you can probably prevent a lot of chronic illnesses. Many of the ways that cancer grows and multiplies, vitamin D stops those steps from happening, so it probably is a cofactor, and probably having normal, not super physiologic, but normal levels, maybe 40 to 60 nanograms per mil, is a reasonable target range for our vitamin D. Okay, so here's some references for complementary medicine at the National Institute of Health, the OCAM, Office for Center Complementary and Alternative Medicine, NCAM, the National Center for Complementary and Alternative Medicine. They have some websites. I love the Office of Dietary Supplements. They have great dietary supplement fact sheets. So if you're looking to see, well, I want to have what foods contain calcium, what foods contain B12, what foods contain, your whatever, you can look this up, magnesium, this type of thing, and very, very excellent website. There's also our About Herbs website through the Integrative Medicine Service at MSKCC. This has won many awards. There's 270 monographs on here, and just because we have a monograph does not mean that we are advertising or advocating for any therapy. There are some of these metabolic therapies, oxygen therapies, there's bogus things that we also discuss on there because these are common questions that patients have. There's an app that you can download free for your iPhone, iPad, and all of that. So this is a wonderful resource for you. And if you have questions about something that we don't have a monograph on, write to us, and we will look into writing a monograph because we're always adding new ones. Dr. Simon Young is a research pharmacist. He's from China. He's Chinese. He's an herbalist, acupuncturist, and pharmacist. So he walks both sides of the world, and he spends most of his time on our website. And it's a wonderful, wonderful resource for you. Okay, so our summary: eat food, not too much, mostly plants. Be physically active every single day, no days off for good behavior. All right. Tell your oncologist about any herbs or supplements that you are taking, because things are popular, like green tea, very, very popular. We know grapefruit interacts with 84 different medications that we know of, probably more that we haven't even looked at yet. Green tea does similar things, Velcade, bortezomib, one of the monoclonal antibodies we use in myeloma. People were taking large amounts of green tea and getting the Velcade, and they weren't having side effects. And here, it was because the EGCG molecule was binding to the bortezomib, taking it out of their system. So, they weren't getting their chemo. Of course, they weren't going to have side effects. So many of the botanicals and these things that we use, they have unpredictable side effects, not necessarily related to their purported mechanism of action. So you have to be very mindful. Think about the stress reduction, the mind-body massage benefits, very, very important, for helping the body to be resilient and decrease side effects. And also consider adding acupuncture if it's available. Acupuncture is one of the traditional Chinese medicine things. Many of the acupuncturists are also herbalists, so be careful if you see a TCM practitioner. If they say, we'll do these needles and take these herbs, be very careful, go back to your oncologist and make sure that it will not interact with your specific treatment. All right, so I want to thank you very much for your time and attention, and be happy to take questions.
Wesa, thank you very much. I know that there's a lot of questions around this topic. Do we have any questions in the audience? Oh, wow, look at the hands just go up. Okay, let's have one here in the front row.
I need to gain weight, so I've been told to take Boost or Ensure. What are your thoughts about that?
Okay, the question is how to gain weight, and would Boost or Ensure be a good way. It can be. It's a little rich, so not everybody tolerates that. If you can add that, that's fine. It also has added vitamins and minerals to it, so if you're having more than, say, 1 can a day, then I would be a little bit concerned about overdosing on something, especially like vitamin A and vitamin E, which can be a blood thinner. Vitamin A can be toxic. It also interacts with the vitamin D receptor, and so can block vitamin D. So making high amounts of that are not necessarily good. Making smoothies. Take yogurt or something, that you like. I like yogurt. It's got the probiotics, which is very beneficial. And so take that, add some fruit, whatever kind of, fresh fruit is best, frozen next, canned the worst. Very lot of sugar in that. They don't use high quality fruit in that. And I like the plain yogurt, not the kind that has the fruit on the bottom because it's low quality fruit and they add too much sugars to it. Okay, so take your plain yogurt and get the full fat yogurt. Don't go to the reduced fat. Full fat yogurt, organic or the no hormone, no antibiotic. You don't want the growth factors. You don't want all that other stuff in there. Add a little whey protein powder. Whip it up in the blender. You can add some chia seeds. That thickens it up. It's an excellent source of omega-3. Add some coconut oil. Okay, it's a solid, above 74 degrees it's liquid, but below 74 it's a solid. Add some of that. Like olive oil, the coconut oil should be unrefined or cold pressed. Okay, when they refine it, they heat it. That alters the fat and makes it you get the trans fats, which are very harmful. So you want the unrefined or cold pressed for that. And drink that every 2-3 hours. Really, that'll help. Drinking your calories, having your pureed soups, the lentils. Lentils are very nice. They just sort of dissolve when you cook them. And so it's very easy on your body. Hummus, these kinds of things. So you can add that. Add some nuts also. Walnuts are excellent for the omega-3. Almonds are great for the calcium. Every almond gives you 3 milligrams of calcium. It's great, great. Almond milk, I'm not a fan of. That is more of a food fad. There's all sorts of chemicals in there, preservatives. 8 ounces of almond milk gives you 1 gram of protein, 450 of calcium, all of which is fortified, and you don't want more than 500 milligrams of calcium in any one day from a fortified food or from a supplement because that increases your risk of heart attacks, about 30% increased risk of heart attacks. Cow milk has been villainized. This vegan movement is out there, but it's really not based in science. It's challenging to get adequate calcium if you're not taking dairy. 8 ounces of cow milk gives you 8 grams of protein, not 1 from your almond milk. So you get 8 times the protein and 300 of calcium, all of which is natural. So using your yogurt, your milks, these things are excellent base. And plus, especially the yogurt, you get the probiotics, and that will help you. So use that, and every 2-3 hours, think about drinking something, okay?
Good question.
Yeah.
Okay, we have one here. Go ahead. You have the microphone? Yes.
I didn't hear anything about baking soda. Is that a true or a myth about its benefits?
Okay, the question is using baking soda, is that a benefit? No, it's not. That is part of this whole acid-alkaline thing to, quote-unquote, neutralize the acids. Your stomach pH is 2, because that's the pH your digestive enzymes need to be in order to work. If you are taking the bicarb, that's just increasing your stomach pH, making everything work better. That's assuming that you still have a stomach. If you don't have a stomach, then it's nonsense. You're not going to digest your food. It isn't going to change your blood pH. So forget about it. Save your baking soda for if you're baking, or open it up, put it in your refrigerator, and it'll absorb the odors. That's the best use for it. Okay. Yes.
What about juicing and excess antioxidants that might be a result of juicing?
Okay, the question is on juicing and overdosing on antioxidants. Thank you for asking that. No, I'm not a fan of juicing. I love the blender, using your Magic Bullet, your Vitamix, or I just have a regular blender that I got at Macy's. I use that. All right, super strong. When you juice, 1 carrot, not the mini ones, but the regular size carrot gives you enough vitamin A for a whole day. We put 1 carrot through a juicer and we get this much. You say, well, that's nothing. I need this much. So you're putting 10 or 15 carrots in there, and you're overdosing. People put pounds of things in the juicer, where the juice comes out one end and the pulp and the fiber comes out the other. Our body absorbs liquids very quickly and solids much slower. When you have the pulp and the fiber, you get a much slower rise in your blood sugar. You have the liquids with the juicing, and you get this immediate spike in your blood sugar. And then your pancreas has to secrete all this insulin, so, which is, your body is thinking, oh my gosh, I just had this huge meal. All right, so, but you just had juice, and so that dissipates, and then your blood sugar plummets because you've had this high insulin spike. People get weak and woozy, and then they feel terrible. The proponents for the juicing say, well, you're detoxing. They say, hogwash, you're getting toxic from what you're doing. You get this spike and valley and spike and valley. It's very dangerous. And these high insulin states are like what I said, they drive the growth factors, and that drives obesity because that puts the fat into your cells. So you don't want that. You want steady blood sugar levels, all right? So I'm not a fan of juicing, and you're going to overdose. You would never be able to eat 15 servings of vegetables in a day, but yet you put 15 servings of vegetables in a juice, so you get this much juice, say, great, feel good, but you're overdosing, all right? And especially, antioxidants protect cells. They protect cancer cells just like they protect healthy cells. So once we already have the disease, you don't want to have that. And when they've looked at giving high levels of antioxidant supplements, the best result is no effect. But what happens more often is that there's more cancers in the antioxidant group. When they tested beta-carotene, to try and prevent lung cancer in smokers, all right, many high-quality studies done here and in Europe, anywhere between 18 and 38% increased incidence in lung cancers in the beta-carotene group versus placebo. The SELECT trial, over 10,000 men in the US, they were giving selenium and vitamin E to men who had high PSA levels, abnormal biopsy. They did not have prostate cancer yet, but they were at high risk. They gave 4 groups. Selenium alone, vitamin E alone, both selenium and vitamin E or a double dummy. The only group that did well was the ones who got the double dummy. That study was stopped 7 years early because it was unethical to continue giving the supplements. All right, the selenium group alone had more diabetes, the vitamin E group had more prostate cancer, and the group who had selenium and vitamin E had higher levels of prostate cancer. They followed these men, after they stopped the study, those curves continued to separate. So, you don't know. You don't want to be taking these supplements. You don't. You really don't. Eat food. Eat food. Eat food. Selective nutritional deficiencies we will replete, like vitamin D, vitamin, B12. If you're lower on some of these others, then we will add. And I do use some supplements judiciously. And, many times I'll use the medicinal mushrooms because they are immunomodulators. But, those are in select patients. It depends on their regimen, too. Okay?
I have a question for Dr. Ilson. This is a follow-up. I know Sloan-Kettering has an arrangement with IBM and the Watson supercomputer. Do you see a time when that will produce better protocols? And is anything being done in stomach cancer in that regard?
It's really not been rolled out yet. I don't know. I think it's going to be a tool to help organize information and select pathway options. But I don't think we're ready. It's not ready to replace doctors.
Any more questions? We have one here in the front and another one here in the front.
Yes, question for Dr. Ilson regarding blood markers, biomarkers. I've been told that there are no blood markers for gastric cancer. I'm a little bit confused on that. Can you explain?
Yeah, I didn't talk about blood markers. When I talk about biomarkers, it's something you test in the tumor, like HER2, the HER2 positive, or looking for mutations in cancers. Blood markers is a blood test that you're looking for CEA or something. There are no blood markers that are approved for stomach cancer to follow patients. There are some that correlate. I mean, if you're on treatment for active disease, some will follow a CEA or CA19-9 that may correlate with the CAT scan. But to use blood markers for follow-up or surveillance of patients, no. So a blood marker is not a biomarker. A biomarker is something you test in the tissue to see if you're a candidate potentially for a particular drug or treatment.
I have a quick question actually online. Someone was asking, I think Jordan Berlin was saying that, S1 is not available here in the United States. As you know, the phase 3 trial was negative here in the United States. However, someone who lives here in the United States who is of Asian origin, where can they find a doctor here in Asia in order to potentially get it?
I'm a real naysayer with S1. I think S1 is probably not any better than Capeside of Beam.
Right.
And there are, S1 is not a magical drug. It's just a different formulation of 5-FU that may have less toxicity. If you look at post-operative chemotherapy trials from Asia, S1 was worked in Japan, but you've got positive data for Xeloda from Korea. So I don't think, to me, the only advantage of S1 is it has a little bit less toxicity, but there's no magic with this pill, and I think Xeloda or Capeside of Beam would be completely acceptable substitute.
Great.
And if they really want it, they would have to go to Japan. Now, once they
right.
go to Japan, you can bring it back to this country and take it. But it's not for sale.
There's no
in this
evidence it's
country.
any better.
Yeah.
I mean, it's
And
not
there's
really
no
any better.
evidence, right?
But you know, if somebody really wants it, you would have to go to a country where
Okay.
it is marketed.
It's available in Europe. They did approve it in Europe.
Here's another question for the panel. To what extent does spleen embolization help cancer patients' body deal better with cancer treatment?
Not at all. That's crazy. No, your spleen. You need your spleen to fight infections, and knocking out your spleen is not going to help you fight cancer. I mean, if you're a lymphoma patient and you need a splenectomy to treat your lymphoma, that's a different issue. But spleen is part of normal health and the immune system, and I've never heard of such a thing. And
There are just a few cases where splenic embolization may help, and that's in the patient that has a splenic sequestration syndrome, meaning that the platelets are very low, and therefore you can't get chemotherapy. And if the spleen is markedly enlarged, and it can be demonstrated, and there are tests we have to do to demonstrate that the platelets are there, they're just in the spleen, and one can do splenic embolization for that syndrome. But that's not to treat the cancer, that's to eliminate the platelets from residing in the spleen so that they're in the circulation. So it's not a cancer treatment.
Here we have one in the
One
front.
quick question, mushroom pills. Mushroom pills good for stomach cancer?
For what?
Will it help?
treating?
Will mushroom
just
pills shrink tumors in stomachs?
Yes, regarding the medicinal mushrooms, they are immunomodulators. Not all mushrooms are the same. They have different constituents depending on the mushroom type and whether they're grown in a greenhouse, under controlled conditions, or whether they're harvested from the wild. Some of the mushrooms have, like reishi, have high antioxidant properties, so I would be careful with reishi if you're going to be using it in conjunction with any kind of treatments. So I don't like the mushroom combinations because they can, the markers say, it's a proprietary blend, so I don't really know how much mushroom you're getting. We had a clinical trial, a dose escalation trial using the maitake mushroom extract at Sloan, and these were in women who had breast cancer when they finished their treatment. We started at 0.1 milligram per kilo and went up to 10 milligrams per kilo. If you gave a different dose, the optimal dose was actually 3 milligrams per kilo twice a day for that particular mushroom. If you gave too much or too little, you actually impaired the immune system. The immune system is very elegant, as we heard, and there's a whole host of cascades when you do this, and so you don't want to be giving the wrong dose. And so it really depends on the mushroom itself that you're using. Now, for gastric cancer, we have more data with the Coriolis. Not all oncologists are comfortable using the medicinal mushroom extracts. The Coriolis is generally tolerated well, but not always. But I use that one a lot because it doesn't have significant adverse herb-drug interactions. But again, we need to be mindful if somebody is malabsorbing. It can cause some nausea, it can cause some bloating and some diarrhea. So you don't want, not everybody necessarily would be a candidate for this one. But it may be helpful in certain. Well, no, I wouldn't say that it shrinks tumors, but you wouldn't want to use it alone, definitely not as a sole agent. I had said that earlier, that if you are in parts of the world, such as China, where they only have access to herbs, the outcomes are not the same. So definitely not as isolated therapy, but perhaps as an adjuvant. I think that that's certainly a reasonable thing, to be considering. But not all of the medicinal mushrooms either, certain ones. Okay.
And you have to be very careful with mushrooms as well as other compounds. If there is any liver disease, whether there's tumor in the liver, or if the patient has diabetes, there may be a condition called steatosis of the liver that you might not want that compound. And they inhibit chemotherapy, especially irinotecan, docetaxel, epirubicin, and paclitaxel. So if one is on any of those chemotherapies, they may decrease the effectiveness of the chemotherapy.
Okay, we have a question up here in the front.
Yeah, my question's for the panel, but it doesn't sound like there's a whole lot of hope for neuropathy as far as anything proven. But the question is this. I went to a seminar. They were promoting LED lighting or therapy to go in and shoot at the small, medium, large nerves. And they treat mostly diabetics, but they also have cancer patients. And they say if it goes too long, of course, they can result in nerves dying, circulation, veins, amputation, that sort of thing. So I guess two things. One, is there any thought at all on LED lighting and that type of therapy for neuropathy? And number two, if I have to continue chemotherapy and the neuropathy gets worse, which it probably will, I haven't had treatment for 2 or 3 months and it's getting worse, hands and feet. If I continue the treatment and it continues to get worse, could it ultimately lead to nerve damage, circulation, veins to the point to where it's like a diabetic, to where you could actually have amputation?
So the question is related to neuropathy. What can be done about it? And suppose the patient's tumor is showing an excellent response to treatment and is shrinking, and there is the appropriate outcome. What do you do? There are a number of clinical trials ongoing evaluating various agents in both the prevention and treatment of neuropathy. A number of agents that are currently available, such as Lyrica and gabapentin and others, have been evaluated. Some patients note benefit, but it has not been consistent across all patients and across all agents. There are clinical trials ongoing, and certainly we work to continue. There are some patients who don't want to stop therapy and who won't even tell their doctors or other providers about the difficulties that are experienced. So what I tell my patients consistently, let's discuss how bad the neuropathy is, where do we stop, where do we switch to another therapy that might have less neuropathy. And unfortunately, for some patients, once you stop the treatment, there can be progression of the neuropathy. So it can get worse even after the treatment is discontinued. So the main thing is communication with your team. It is a side effect of therapy that we have just not cracked the nut yet to find out what we can do to prevent it, what we can do to treat it, and then once it occurs, what we can do to reverse it. And certainly, we don't want patients to end up with a very poor quality of life style, and that has occurred. Every patient has what we call their stopping point, and I've had patients who did not stop or did not inform us until they required a cane or wheelchair or other devices for assistance in mobilization. So we don't want any patient to suffer with life-threatening problems that are a result of treatment. So
diabetic is not a good analogy, because diabetics get amputations from vascular disease, not from neuropathy. So oxaliplatin doesn't cause peripheral vascular disease. So you shouldn't worry that you're going to, but and we know in colon cancer, for example, we routinely stop oxaliplatin after 3 to 4 months and keep people on 5-FU alone. And then reintroduce the platinum drug later. That's increasingly becoming a strategy in gastric cancer. You just have to stop the drug. Some people get neuropathy earlier, some people get neuropathy later, but you really have to stop it when the numbness and tingling become more persistent. But it's not a vascular risk. That's no concern whatsoever.
It's not the same as diabetic neuropathy, and the neuropathy from oxaliplatin and cisplatin is very different from that of paclitaxel or docetaxel. So just because a patient, for example, has diabetic neuropathy doesn't mean that they can't get oxaliplatin. They're totally different.
Dr. Wesa, can you comment a little bit more about that? I know that you have some background on neuropathy there.
Yes, the use of acupuncture for chemotherapy-induced peripheral neuropathy has been looked at in a number of clinical studies, and there is evidence that it can help to prevent progression. Not in everybody, but in select patients, and so I think it's definitely worth a trial. The risk is low, and there's a high potential benefit, and so that is something that I would use. And typically, the regimens are once or twice per week for 6 to 8 weeks. And so you do 8 to 10 sessions. If you're not really seeing much of a response at that point, then you could consider discontinuing the acupuncture, but I would certainly give it a try because, as I said, the risk is low and the potential benefit is really very high. Nerves grow very slowly, and so, sometimes you can see a delayed response from acupuncture. I also use vitamin B12 a lot and low-dose B6. Depending, especially with paclitaxel, that seems to help. Too much B6 can be a problem. That also can cause neuropathy. So we need to, you need to work with your oncologist, but those things can be of benefit. Things that have been used for diabetic neuropathy, like alpha-lipoic acid and N-acetylcysteine, these types of things, I think are problematic in the cancer setting, again, because you're looking at a totally different mechanism. And so it depends on what the situation is, but the low risk, high potential benefit would be definitely acupuncture, and B12 you should be on anyway, really, and and most of us over the age of 50 are not as efficient at absorbing the B12 that we get from animal proteins anyway. So think that and consider the B6.
Okay, great. Thank you very much. We're going to move on to our next stage now. We're going to have our patient panel. So thank you so much for the presentations today. That was really great.